Hello, everyone, and thank you for joining us today. My name is Derek Hunter from CMS's Division of Value-Based Incentives and Quality Reporting, and I will be moderating today's forum. This bi-monthly forum aims to provide national stakeholder organizations, specialty societies, health IT organizations, and EHR vendors with information relevant to CMS's Quality Measurement and Value-Based Incentives Group. Next slide, please. Our program today will include updates on the Medicare Promoting Interoperability Program, the ECQI Resource Center, the QRDA3 Implementation Guide, the September 2021 FHIR Connectathon, the Outpatient Quality Reporting STEMI ECQM webpage, the Quality Payment Program, and alternative payment methods. We will have a question and answer portion once all presentations have concluded. Please note, to ask a question, you can either submit your question using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio pin entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone. And now I will turn it over to Drew Morgan. Drew, you may begin.
Thanks, Derek. So good morning and good afternoon to those folks. I'm going to just talk briefly about the PI hardship submission window that's currently going on for the Promoting Interoperability Program. Next slide, please. So the Medicare Promoting Interoperability Program hardship exception application is currently open. It opened on May 1st of 2021, and that's to cover a hardship exception for the 2022 downward payment adjustment for acute care hospitals and the 2020 downward payment adjustment on critical access hospitals reimbursement. The deadline for eligible hospitals and critical access hospitals is September 1st of 2021. You can go online to ServiceNow. There's a link provided here that will take you to the online application. Fill out the application, and once submitted, you will be notified immediately if you have received the hardship or if you've been denied. Again, make sure you go in before September 1st of 2021 at 11:59 p.m. is when the deadline closes. Next slide, please. And here is just some information. You can go to our website for more information. This will be provided later after the webinar. Next slide, please. And I will turn it over to Vidya that will talk about the Electronic Clinical Quality Improvement Resource Center updates.
Thank you, Drew. Hello, everyone. Edna Boone and I are going to go over some of the latest updates to the ECQI Resource Center, which shares information around quality standards and technologies for quality improvement. Next slide, please. So the Measure Collaboration Workspace, or MCW, is a collaborative portal that supports quality and IT staff at hospital and provider organizations and health IT vendors to more easily implement and use electronic clinical quality measures, or ECQMs. The MCW promotes transparency, and better interaction across stakeholder communities that develop, implement, and report ECQMs. The ECQM Data Element Repository, or DREP, is a module on the MCW which provides data element definitions to aid in measure implementation and data mapping. CMS has updated the ECQM DREP for calendar year 2022 reporting and performance periods. Next slide, please. So the ECQM DREP provides information on the data elements and their definitions for published ECQMs used in CMS quality reporting and incentive programs. The updated data elements provided are for use in ECQMs for 2022 performance and reporting periods and include associated value sets or direct reference codes, QDM data types, attributes, and entities. The intent of the ECQM DREP information is to improve clarity for those implementing ECQMs. Next, Edna will cover how to locate the MCW and the DREP on the ECQI Resource Center. Next slide, please.
Thanks, Vidya. The ECQM data element repository is located within the Measure Collaboration workspace of the ECQI Resource Center. You can navigate through the Measure Collaboration workspace, and now we have added a direct link from the ECQM menu. Next slide, please. The Measure Collaboration workspace has 4 modules. The ECQM data element repository is one which provides the data definitions to aid in measure implementation and data mapping. Next slide, please. Once you're within the ECQM data element repository, you can search by year and filter by eligible clinician, eligible professional, or eligible hospital, critical access hospital. And a list of all measures for those given reporting year will be displayed. Clicking into that measure or into those links, you will receive the data elements for each of the individual measures. Additionally, there are direct links to the data element repository from the individual measure pages. This provides, again, direct data elements used by that particular measure. Next slide, please. We always encourage you to visit and provide feedback on the ECQI Resource Center and the Measure Collaboration workspace by emailing your comments or suggestions, questions to ecqi-resource-center@hhs.gov. And you can also visit our ECQI Resource Center and Measure Collaboration workspace frequently asked questions. Next slide, please. An additional update is we wanted to remind you that we have an implementation checklist. We just came out of publishing the annual update of the electronic clinical quality measures. So we do have an implementation checklist and recently updated it. There is a link to this checklist on the top of the ECQM implementation resources table, both on the eligible hospital, critical access hospital, and eligible professional, eligible clinician measure pages. There are also direct links to these pages at the end of this presentation. Next slide, please. The implementation list is comprised of both preparation and implementation checklist items. Next slide. Each item on the list expands, providing the end user with instructions and links to necessary tools and resources for that given step. Next slide, please. You're seeing a list of the current preparation checklist items. And then next slide, the suggested implementation checklist items. Next slide, we have also provided this checklist in a PDF format so it can be downloaded and used at your facility or within your organization. Next slide. Again, the checklist is located on the eligible hospital, critical access hospital, eligible professional, and eligible clinician measure pages on the implementation resources table, and the direct URL is listed here. And last slide, again, we encourage you to use this checklist and to send suggestions and feedback for its improvement. We really strive to constantly improve the information and tools on the ECQI Resource Center, and we really rely on your input to make it as useful as possible. Thank you.
Next, we have a presentation from Jennifer Seaman.
All right, thank you. Next slide, we'll just go through a couple of quick updates. First, regarding the 2022 CMS QRDA3 IG. That IG and its supporting documents were published on July 14th. At a high level, really, we've removed the guidance and conformance statements for CPC Plus reporting, and we have updated the UUID list for the MIPS calendar year 2022 reporting period. Next slide. Related to those changes, we have also updated the schematron, basically to remove the conformance statements for CPC Plus, and updated the sample files to also denote that removal. As a note, we will have a subsequent publication of this IG following the final PFS rule later this year. Next slide. To access the updated IGs and find out more about QRDA and ECQMs, please visit the ECQI Resource Center. That link is provided. If you have questions regarding QRDA implementation guides or schematron, you can post those in the ONC QRDA JIRA project. And also within that project, you can review any known issues related to QRDA on the known issues dashboard. Next slide. We'd also just like to announce that the ECQM standards team will be supporting the clinical reasoning track again in September, and invite folks to participate in that Connectathon. That will be a virtual event that takes place September 13th through the 15th. We can work closely to test draft versions of ECQMs that have been translated to FHIR. There is a link to the Connectathon FHIR page that's at HL7 Confluence site for more information. Also, if you're interested or have questions or want to receive updates as we get closer, feel free to email us at fhir@esacinc.com. And that is the end of my updates. I will pass it to Tamara. Thank you.
Thanks, Jen. Hi, everyone. My name is Tamara Mohammed, and I am a Senior Health Outcomes Researcher at the Yale Center for Outcomes Research and Evaluation. And today I'll be providing you with a brief presentation on the recently created OQR, or Outpatient Quality Reporting, pre-rulemaking page on the ECQI Resource Center. Next slide, please. So as some of you might be aware, last week CMS released the proposed calendar year 2022 OPPS, or Outpatient Prospective Payment System rule. And in that rule, CMS proposed their first ever ECQM in the OQR program. Specifically in the rule, CMS proposed the use of the STEMI ECQM measure in the OQR program. And given this, they have updated the ECQI Resource Center to include pages that stakeholders reading the rule can refer to access the specifications of the ECQM being proposed under the OQR program. So we'll review where you can find this page on the ECQI Resource Center, but for now, to provide you with a bit more information on the actual measure, the official name of the measure is Appropriate Treatment for ST Segment Elevation Myocardial Infarction, or STEMI patients in the emergency department, or ED. And this is a process measure that measures the percentage of ED patients diagnosed with STEMI that have fibrinolytic therapy within 30 minutes of arrival to the ED, or that are transferred to a PCI capable, so that's a percutaneous coronary intervention capable facility, within 45 minutes. The measure also captures transfer and non-transfer patients who receive PCI at a PCI-capable facility within 90 minutes. And as this is an ECQM, the measure is calculated using data from the EHR, or electronic health record. Next slide, please. So to find the newly created pre-rulemaking page on the ECQI Resource Center with information on the measure, you go to the home page of the website at https:// www.ecqi.healthit.gov. It's listed at the bottom of the screen there for you. And then from the drop down at the top of the page, under ECQMs, denoted at using the arrows you see here on the screen, you select OQR, pre-rulemaking ECQMs, under the ECQM EHCAR ECQM section. Next slide, please. So once you click on that link, it'll take you to the page you see here that lists the ECQMs being proposed under the OQR program in the OPPS rule. As we only have one ECQM being proposed under the OQR program this year, you'll only find information on the STEMI ECQM listed here at this time. The value set for the STEMI measure is located at the bottom of the page, but if you follow the red arrow and click on that link, it'll take you to another page with the specifications of the STEMI ECQM measure. Next slide, please. So clicking on the link in the previous slide takes you to this page. And if you click on the Specifications and Data Elements tab, then you'll be able to download the Measure Authoring Tool, or MAT, and mark artifacts resources for the STEMI measure. Next slide, please. And finally, if you'd like to learn more about what CMS is proposing for the STEMI ECQM measure, you can take a look at the proposed calendar year 2022 OPPS rule. And if you have comments, feel free to submit them to CMS by September 17th, which is when the comment period closes, using one of the mechanisms you see listed here on the screen. Next slide, please. And now I'll turn it over to Katie Moore from CMS for the next segment of the presentation.
Great, thanks, Tamara. And good afternoon, everyone. Again, my name is Katie Moore, and I am with the Division of Electronic and Clinician Quality here at CMS, and I'm going to go through a number of different updates related to the Quality Attainment Program. Next slide, please. Okay, first, we're going to just do a few updates related to 2021 performance year. So if you haven't noticed already, our exception applications are available. Similar to, I think Drew mentioned earlier about promoting interoperability. Our promoting interoperability exception application is different than the promoting interoperability program. This is specific to MIPS, so the merit-based incentive payment system. I just wanted to kind of highlight that. I know sometimes we get mixed up. But so we have two exception applications that are available for 2021. So the first one is the extreme and uncontrollable circumstances exception application. So that allows clinicians that are facing any kind of exception or hardship outside their control, such as fire or national disasters are typically what we've seen. But in the past couple of years, this exception has also been applied to individuals impacted by the COVID-19 public health emergency. And we did finalize through rulemaking that the exception application will be applied with COVID-19 as a reason. So that is available for folks. This is different than our automatic policy. So this is not automatic. So clinicians would actually have to go in and apply for this reweighting to happen. So they can apply for any or all of their performance categories. One little difference here I just wanted to note was that APM entities, so alternative payment models, can also apply for an EC exception due to COVID. However, they have to request weighting for all performance categories. So that is our EC application. And then we also have our promoting interoperability performance category, hardship exception. This is for clinicians that need specific reweighting just for that specific performance category. And this, there's a number of reasons that people could need this. They could not have internet connection available where they are. This is helpful to a lot of our smaller or rural practices. But more information is available on both of these applications at qvp.cms.gov. And we have a number of resources available in our resource library that explains both of these and how to apply. But important date here to note is that they are open right now, and the deadline is December 31st at 8 p.m. Next slide, please.
Okay, shifting gears a little bit to future policies. Hopefully folks have seen, I know we've had a number of CMS rules coming out here lately. As we just heard, the OPPS rule is out, but we also wanted to highlight for everyone that our Medicare physician fee schedule, so PFS proposed rule that includes quality payment program policies for 2022 was also released on July 13th, very recently. And before I go into just super high level information on what you'll be able to find in that proposed rule for QPP, I wanted to make sure that folks were aware that we did have a public webinar recently, that last Wednesday on the 21st, that goes into a whole lot more detail. It was an hour and a half webinar presentation, and then another, I think, 15 minutes of Q&A that we were able to get to. But just wanted to make sure you knew that was available if you want more in-depth. We have a lot of our subject matter experts that were on that presentation, so it goes into a lot of detail in all of the different areas of the program. So we will be posting that to our webinar library here very soon, so I encourage folks who want more in-depth information to go check out that presentation. We also have currently on our QPP resource library, we have a zip file that contains a lot of helpful resources. We have an overview fact sheet, and I believe we have links in this presentation a couple slides from now that has our overview fact sheet that gives high level of all of the QPP proposals, and then we have a comparison chart. I know that folks have found that helpful in the past to see what's changed from the previous performance year to what's being proposed. And then we also have a new table that lists out all of our MIPS value pathways, proposals, and additional information. So encourage everybody to go to our resource library and check that information out. But I'm going to just highlight a few key policies that we've proposed. A really big one that we're excited about is our MIPS value pathways, so MVPs. We're proposing that these will begin in the 2023 performance year. We have our first 7 options, and if you're joining now and have never heard of MVPs before, we have an entire website, or not website, web page available that goes into more detail, and again, some more webinars from past presentations available in our webinar library, but that just really explains what MVPs are. But in a quick 2-second nutshell, it's going to be a new way of participating in MIPS, the merit-based incentive payment system, and it is a collection of measures and activities that are really relevant to a specific clinician type or a specialty or a condition. So we have proposed for beginning in 2023 our first set of 7 MVPs. So they will include the following clinical topics: rheumatology, stroke care and prevention, heart disease, chronic disease management, emergency medicine, lower extremity joint care, so hip replacement, knee replacement, examples, and then anesthesia. And there will be more coming, but for our proposed rule, these are our first 7. So encourage folks to go check out all of that information in the rule as well. They have a lot more details, including what measures and what activities will be included in those specific MVPs. Okay, next point. So we have, based on a lot of stakeholder feedback that we've heard recently, we have proposed that the CMS Web Interface will be extended into 2022 and 2023, specifically for the Shared Savings Program, ACOs, or Accountable Care Organizations, as a collection type and submission type for quality measure reporting. And wanted to flag that for other registered groups and virtual groups and other APMs that are not Shared Savings Program, they will have this option, so CMS Web Interface will be available in 2022 only. So it is an extension past when we had intended to sunset it after 2021, but just wanted to make sure folks were aware that that will still be available next year and then into 2023 for SSP ACOs. And then we just have a number of other updates related to cost measures, our improvement activity inventory, And then some revisions that were made to promoting interoperability performance category, our reporting requirements there. And we really had some minimal APM related updates as well. So just trying to keep things going without having too many changes each year. So I know folks were happy about that, we hope. Next slide, please. Okay, so in addition to those proposed policies that we just highlighted, we are also seeking comment on a number of different proposals in this proposed rule. We have some RFIs out as well. We are asking for comments on traditional MIPS being sunset after the end of 2027 performance and data submission period. So we have a timeline graphic available to help illustrate what we are seeking comment on. So we're looking definitely for feedback from folks on what makes most sense. So we're also seeking comment on development of this new cost measures by stakeholders, appropriate number of procedures done, conditions at facility types for CMS, proposing to add affiliation, and types and utilization of data that could be added to our care compare. So data that we release every year to help inform patients on healthcare, on their healthcare decisions. So information about how clinicians are doing in the program. Next slide, please. Okay, so if you're able to join one of our public webinar we had on this, we are definitely collecting information informally that way, just to hear how stakeholders feel about these different proposals. But what we really need is any comments or feedback that you or your organization has related to any of our proposals or our comment solicitations. We really need that information submitted through this formal commenting process. And all of those comments, another key date here is September 13th. I believe the OPPS rule deadline was the 17th, I believe, the comments, and then PFS is September 13th. So there's a lot of different ways you can submit information, but in the rule, it definitely explains in greater detail on how, where to go and submit comments. So please submit any feedback you have through that process. Next slide, please. Okay, this is just some helpful links that list out a number of the resources that I mentioned previously, overview fact sheet, comparison table, MDP proposals, as well as that MDP transition timeline that we're seeking comment on through the rule. Next slide, please. So self-nomination, I believe a number of folks on this call, this is probably not new information, but I'm gonna go ahead and explain it. But so we have this process for self-nomination. So for qualified clinical data registries are QCDRs and qualified registries. They must do this every year. So if they want to be a QCDR or registry that is approved by CMS, these third-party intermediaries that are going to collect data on behalf of clinicians that are participating in QPP, and then they submit that data on behalf of those clinicians. So any entities that want to become a QCDR or registry with CMS, they need to complete the self-nomination form. So if you are on this call and hearing this and you're a clinician, a MIPS eligible clinician that might want to use a QCDR or registry to help submit your data to CMS, you do not need to self-nominate. This is just for the organization or entity itself that wants to be a QCDR or a registry. So more information, we have a toolkit that lists out every detail you possibly need to submit, as well as a recording that demonstrates how to do this within our system, and some slides as well. So all of that information can be found at our QPP resource library as well. And I believe the next slide has some more information on the upcoming webinar about it. We can go ahead to the next slide. Oh, yes, okay, great. Here, so in the box on the right-hand side, you'll see just information. I believe that's a link to register. If you have questions about self-nomination process, we're having a virtual office hours coming up on August 18th from 1 to 2:30. So all of the right folks will be available there if you have any specific questions. So I encourage you to register if that applies to you or your organization. And then just a few other resources we wanted to highlight that are recently added to our QVP resource library. We have a draft COVID-19 vaccination measure specification. So it's going to give some details on, this wasn't proposed, this is just a potential measure specifications for a possible COVID-19 vaccination measure that CMS is working on. So this quality measure, as I said, it hasn't been proposed for inclusion just yet, but we're seeking some comment and just trying to get additional information on what folks think about it before we would propose it. And then also wanted to highlight that our QP, so that is our qualifying APM participants, QP's notice for APM incentive payment. This is very important. If this applies to you or any of the clinicians or organizations that folks on this call might work with, we have listed out all of our QPs that CMS, we haven't been able to verify banking information for, so we've dispersed our 2021 APM incentive payment, which is great. We're trying to get clinicians all the money that they are deserve for participating in this way in our programs, and we want to make sure folks get the right money that they should be. So we have a number of QPs that we're trying to get them their money to them, and we just need to verify banking information so that we can get it there. So please share that information and tell any clinicians that you work with that are involved in APMs to check that list out and make sure we have their correct information. And then again, related to our QPs and APM incentive payment, we just have a number of learning resources available. It includes details on our QP criteria for 2019 that is related to these 2021 APM incentive payments that have just started rolling out the door. So encourage folks, if you are in that category, please check that out. Next slide, please. I think that might be it. Okay, great. And with that, I am going to turn it over to an expert on alternative payment models, Dr. Corey Henderson. Thanks.
Good afternoon. Next slide, please. I'm going to cover three quick announcements as it relates to alternative payment models. The first one is that the APM incentive payment announcement is now out. We made that announcement on June 25th. This information you just heard from Katie, but it's important to repeat it again, that those clinicians and surrogates can now log on to the QPP website using their HARP credentials to verify the information that is on the website. And that includes information about where payment was sent to, how much the payment is, and if you do not see your payment, you can then begin to discover that your information will be listed on the public notice. The public notice allows for you to find, one, are you due a payment? And if your name is there, then you can find out how to get your payment by November 1st, 2021. We need you to fill in that information, at least get us the information back. And that would include the Medicare billing information, so we can make sure we send the payment to the right clinician, the right amount, and to the right banking organization or information that you submit. In addition to that, we also want to make sure that you verify that the information is submitted by November 1st, not that the payment will be made by November 1st. So just make sure that November 1st, 2021, as you look at the public notice, you'll discover a name there. And if you don't see the information when you log into your account, clinicians and surrogates, then you'll be able to see, hey, there's no payment. Let me check the public notice. Let me verify if I'm due a payment. And then that circle will continue. There's additional information, as Katie just verified, on the resource library, under the QPP resource library. Next slide, please. The second announcement as it relates to APMs, or alternative payment models, is our participation snapshot release. What this says is that we have released data on your MIPS APM participation status and also your qualifying APM participation status. This tool includes the 2021 information for dates of service between January 1st, 2021 and March 31st, 2021. This QP status information is very important to help you understand if you will be in the percentage threshold to qualify as a qualifying APM participant and what is due. It also lets you know what you need to do if you meet the MIPS APM participation status, so that when you do the submission or reporting, you have the options available to you. And the next slide will cover a little bit of that. Next slide, please. So as I mentioned, the MIPS APM participation, one of the beautiful things about being a MIPS APM, as you know, is the APM performance pathway, what we call the APP. We've now combined all the tools into one toolkit so that you don't have to search around, try to look on a resource library, or discover new information. As new information is put together by our education and outreach team, in which Katie and I are on, then we will focus on putting these things in a toolkit. So when you download the toolkit, you'll also have a document that kind of displays and outlines what's in the toolkit and the documents that you need to help you understand either the APP, the QP toolkit that we have, and other toolkits that we're making available, so that we can make it easier for our clinicians and their surrogates to be able to find the information and do this work without having to spend a lot of time looking for the information. So currently in the APP toolkit, we have the APP for Shared Savings Program, ACO's User Guide, the 2021 APM Performance Pathway for MIPS APM Participants Fact Sheet, the APM Performance Pathway for MIPS APM Participants Infographic for 2021, the 2021 APM Performance Pathway Quick Start Guide, and the 2021 APM Performance Pathway Reporting Scenarios. And before I send to the next slide, I did want to say you'll notice that we're beginning to start to name things by their performance year at the start of our document names, so that you'll not be confused by what information is most relevant to you, but we've been taking in account the user needs to make sure that we're being helpful and not causing confusion. So as we continue to advance, we look forward to your feedback, and thank you for hearing about the APM Performance Pathway and APMs generally. Next slide. And that's all for me. Ketchum?
Thank you to all of today's presenters. We will now move on to the question and answer portion of the webinar.
And as a reminder, to ask a question, you can either submit your question using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio PIN entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone. Okay, and we do have our first question, and this person is asking, what happens in the PI requirements when vendors do not have 6 relevant ECQMs certified pertinent for our practice to meet the requirement? And I believe this was this question came in during Edna's presentation.
I'm sorry, can you ask that again? Because I'm not sure that's actually part of our work.
Oh, sure, I can repeat it, just to see if anybody else from the group is able to answer. What happens in the PI requirements when vendors do not have 6 relevant ECQMs certified pertinent for our practice to meet the requirement?
Yeah, that's definitely a program question rather than kind of the resource center work. So I think it probably depends. It sounds like that is maybe for Katie and the QPP team.
Got it. Thanks, Edna. And I think I'm going to need to take that back to our PI team, and I'll see if I can get an answer while we're talking. But if not, Ketchum team, if you could forward me that question, and we'll get you a response.
Sure, Katie, we'll send that to you now. But we do have another question on another topic for you, Katie. And this person is asking, if we do not fall under one of the 7 MVP categories, can we continue to report the way we currently are in 2023?
Absolutely. So traditional MIPS, participation through traditional MIPS, which is just how the program has existed to this day, is what we're calling what traditional MIPS is. So how you're participating right now, you'll be able to do in 2022, 2023. And as I mentioned in my presentation, we do have a timeline laid out that we're seeking comment on that will lay out when we would transition from traditional MIPS to MVP. So they'll both be a way to report in the program. So don't worry if you don't fall into one of those 7 categories. You'll be able to participate as you have been doing to this day. And at some point we will transition out of that, but that's definitely where we're requesting feedback on.
Thanks, Katie.
and
then we do have another.
Let me just jump in and say that what Katie was referencing is that as it relates to the question about promoting interoperability, if you go to qpp.cms.gov, under the dropdown at the very top is a MIPS dropdown. We have a whole section on promoting interoperability requirements. And what we want to make sure is that we're not focusing on all of the level detail that you may be looking for and then giving you misinformation or confusing you. Pretty much you're going to be reporting on 90 days worth of data within a time period for objectives under the promoting interoperability performance category measures. And the question is so specific, we want to make sure we give you the right answer. So all of our information is static there as it relates to each year. And we do have some specificity about the different ways of submission, bonus points, and also quick start guides and information there. So if you have additional questions, please feel free to reach out to us. But we definitely want to make sure we try to give you general information that's not specific to one specific situation. So please feel free to check it out on qpp.cms.gov/MIPS/promoting interoperability.
Thanks, Corey. And our next question, I think, is again for Katie. And this person is asking if you can validate if it is being proposed that the CMS Web Interface is available in performance year 2022 for traditional MIPS, promoting interoperability and improvement activities reporting.
Yes, we are proposing that for groups and virtual groups. Actually, for everybody, it's open. We're proposing that it would stay open through 2022.
Thank you. We will stand by for our next question. Okay. And our next question is, for 2022 ECQM submissions for the MSSP program and the all-payer submission, is the MSSP ACO held accountable for performance rates of non-Medicare fee-for-service patients?
Hey, this is Katie. Corey, I don't know if you're able to answer that one, or we might need to take that back to the Shared Savings Program team.
Yeah, that's specific to the Shared Savings Program. I was coming off mute. The problem is that for this call, we're just giving updates. I think that just generally Ketchum can provide. We're going to be doing some specific webinars around APP, ECQMs, and just the APP and SSP submission process and reporting. So we don't want to get ahead of ourselves there. We're working on some education outreach materials related to that, so we can answer those questions in more detail. But while we're in the process of not only the proposed rule, but also the way that we're trying to educate and inform that information, we don't want to get ahead of ourselves. If you have specific questions like that, you can either reach out to our help desk, and they will either answer the question there or reach out to the Shared Savings Program. But we will be providing some additional information in webinar form and also document form and education outreach materials. I know that all payer has been a big discussion topic around that. So just wanted to make sure you guys understand we're not trying to avoid the question. We want to make sure that we're answering it succinctly and correctly because the Shared Savings Program, they have a requirement to use APP. So we want to make sure we give you the right information.
Thank you, Corey. And our next question is, will the ECQM measure specifications on the ECQI website ever be in a PDF format to better understand all components of the measure in order to update workflows to capture EHR data?
Is that for video?
I think that might be for Vidya. And Vidya, I can repeat the question if you need me to.
Yes, I was trying to. Can you please repeat the question?
Sure. So this question is, will the ECQM measure specifications on the ECQI website ever be in a PDF format to better understand all components of the measure in order to update workflows to capture EHR data?
Edna and I on the team, I guess we can talk about that. It's not in PDF right now, but we can explore that if necessary.
Yeah, I would recommend sending an email to the Resource Center with a little bit more detail. So when we talk about the specification, there are actually a fair amount of components with that specification. So if you're talking about, you know, the human readable versus machine readable, also note we do have ECQM flows. They are published for previous years and will be forthcoming for this annual update. And they do really help in terms of workflow and identifying where in the workflow one might capture information for that measure. So I really think it's twofold. It's, you know, it's not just having a PDF, but a PDF of what and what you hope it will help you with. And we could point you to resources that may already exist, or to Vidya's point, you know, consider adding new resources if applicable.
Great, thank you. And I believe we have a phone line question. So Brenda Sims, your line is now unmuted if you'd like to ask your question. And Brenda, your line might be self-muted. Okay, we will try to come back to Brenda to see if she is able to ask her question later. But we will stand by for our next question. And as a reminder, to submit a question, you can either submit it using the questions box or raise your hand and we will unmute your line. Okay, I actually don't see any additional questions in the questions box, and there are no additional raised hands at this time. So I think, Derek, we can turn it back over to you to close the call a few minutes early.
Okay. Thank you all for joining us today. CMS will share the slides and recording from today's forum in the coming weeks. In the meantime, if you have any specific questions, please email cmsqualityteam@ketchum.com. The next CMS Quality Program's bi-monthly forum is tentatively scheduled for September. The CMS will share more information on the next forum when it becomes available. Have a great afternoon.